see, observing noisy, audible wheezing. All right, if we have audible wheezing, Miguel, is that an upper airway problem or a lower airway problem, and why?
I think it's upper.
Adrian, is it upper or lower? Do you agree with him or not? Lower. Lower? And then where do you think it occurs?
I would think it occurs like somewhere in the upper class, the flap. Or no.
That's the upper.
Yeah.
That's the upper. The epiglottis is in the upper airway. It happens in the bronchioles. Okay? When you have wheezing, in case you guys don't know this, you guys have smooth muscle inside everything. Inside your vessels, inside your stomach, inside your GI tract, your intestines, and even inside your bronchioles, you have muscles in here. A patient that has asthma, when they're having an asthma attack, what's really occurring with them is that these muscles have been irritated and they're spasming out. They're spasming out. That's what asthma is. So, because of negative pressure, if this patient wants to take a breath in, that negative pressure is going to expand everything, right? It's going to open everything up. That's negative pressure. So these actually open up, and they can breathe in, no problem. That's not the problem. But it's when they bring the thoracic cavity back in and the diaphragm up, that positive pressure squeezes on these bronchioles, and they're already constricting because of the asthma attack. So the problem with asthma is they have an issue pushing out the air. So when they push out that air and they have these spasmy muscles, they make a whistling sound, and that's that wheezing you heard. Is that they're pushing out. Like when you blow out a trumpet, or when you whistle, you put your lips together, right? You push it together, it makes a whistling sound. Except that it's happening down the lower airway. Any questions about that? So it's when they breathe out. That's when the issue is. They can't breathe out. They can't push. They're having the issue pushing out the air because the bronchioles are already self-constricting. And that positive pressure that's pushing, it's like when you get a bottle that has no, and you put the cap on it very lightly, you squeeze it to push the air out, right? Same concept. You're squeezing with positive pressure. You're squeezing the thoracic cavity to push out. But if you squeeze and they're already very constricted, it's gonna make that whistling sound because it's really forcing that air out. So your biggest takeaway is wheezing is a lower airway issue in the bronchioles. Okay? Wheezing also, what you should know is that, remember, is that wheezing occurs when you're trying to breathe out, push that air out. That's the issue. Gurgling, that's gonna be fluid in the upper airway. What is snoring? That one should be easy for you guys. What is the issue though? What's the issue here? The tongue. Snoring is the tongue. It goes back, it flops, and when you're breathing out, the snoring is like the tongue flopping in the back of your pharynx. That's what snoring is. Strider, Adrian, let's try this again. What problem is this, upper or lower, and why, or where?
Upper.
Okay, we're upper airway. So what's happening in the upper airway? Same concept, but it's happening in the upper airway. So what's going on in the upper airway that's making that strider happen?
Something's getting tighter, so it's...
I'll take that. You have a partial airway obstruction, right? So if you guys don't know that, it's a partial airway obstruction. It's like when you put your lips together again to whistle, except that it's happening in the larynx area. So that's gonna happen in the oropharynx most likely, or hypopharynx. Epiglottitis can make strider happen, or like any kind of infection that makes swelling in the upper airway can make strider happen. Who do you think you're gonna see stridering with in the most, Brian? What kind of patient?
Someone like an airway infection,
Okay, who's more prone to getting an airway infection?
like younger.
Younger kids, right? And why is it an issue, and why would we see that, Ryan? Let's see if you can answer this. Why is it an issue with pediatrics? Why is it particular with them? Why does it affect them more than it affects us?
Because their ratio, their tongue and their openings are smaller compared to adults.
Exactly. And that's why it's an issue for them. And that's why we hear stridor with them. And if we have swelling, usually we won't get stridor.
They don't take tonsils out anymore, huh? Very rarely.
I don't even know. I still have mine, I think.
Yeah.
I don't think so.
I never even knew why you did that. What is that for? Why do you take your tonsils
I
out?
don't even know. To be honest,
Well, you get tonsillitis a bunch of times, so it'd get inflamed, so when you eat stuff, you have pain.
so just so you don't get no more. That's what it is.
So
Yeah,
it's
so
just-
mine were removed, but that was like 40 years ago, so it was a long time ago, but. I heard they don't do it anymore, or they very rarely do it. They take your adenoids out too a lot of times.
Yeah,
At least they did.
Like, being in school, I would always hear like friends be like, "Oh yeah, like I got my tonsils removed like this past week or something like that." Like,
Yeah.
Sounds horrible.
I don't know why though.
Did it hurt for a while?
I don't know, it was a long time ago.
Oh, you were like a baby, like a little kid.
That's fourth grade.
Oh, yeah, that's a long time ago.
I had my appendix removed.
I had mine too.
Yeah, I was like 9 when that happened.
Oh, nice.
That was horrible. So what does auscultating mean? Nate, what does that mean? If you're gonna auscultate, what are you gonna do?
Speak to them, this sounds
And what do we use for that?
just like so, you know.
Mia, you're checking his lung sounds right here. Where are you going to put that stethoscope next?
On the other side
Why? Why not down? Why not below that part?
to compare them.
Compare each side. Good. Auscultating for wheezing, crackles. So here are your definitions of what wheezing and crackles are. I think wheezing, I kind of covered it plenty. And what I'm gonna ask you, Brian, though, is when does wheezing occur? When you're pushing air out or when you're bringing air in an inhalation?
Me?
Yeah.
When you push it out.
Cool. Okay. Crackles, fine crackle, crackling or bubbling sound heard on inspiration. So this is when you have fluid in the alveoli or close to the opening. So the fluid would be, like it says, in the alveoli itself or right at the entrance, so between the bronchial and the alveoli.
So would that be another like indication of pulmonary?
Yes, that's an indication of pulmonary edema. This patient, if I had a guess and I had nothing else to go off of, CHF.
So crackles would be an indication of pulmonary edema.
Possibly, yes. Not always for sure, but possibly.
They just sound like crackling. They wouldn't sound like
Like crackling, yeah. Like best example I could give you is when you have a little bit of fluid in your cup